Good morning, everyone. General, good morning, sir. As was mentioned, my name is Jon Santiago. Thank you for the kind introduction. I'm privileged to serve as the first cabinet-level secretary of the Office of Veteran Services for the Commonwealth of Massachusetts. It really is an honor to be here with each and every one of you to embark on a mission on what I would call one of the most pressing issues of our time, and that is addressing, empathizing, advocating for all things mental health, for a community that desperately needs it, our service members, our veterans, and their families. I want to begin first by thanking the Human Flourishing Program and the Heroes Wellness Collection for bringing us together and making this historic summit possible. Folks, this is the largest gathering of veterans, researchers, and healthcare professionals Harvard has ever seen. And what that tells me is that this moment matters. And I can't think of a more important time than right now. I know so because I happen to wear a few hats that's given me some insight. Now, by no means am I an expert, but I'd like to think that my work as a physician, my military experience, and my roles as a public servant have not only inspired me to do this work, but continue to humble me every single day with the challenges we face. And if I'm honest with all of you, those experiences have also intimidated me. It might surprise you to hear that I almost didn't take this job. Not because I wasn't interested, but because I thought the challenge was too big, that success would be elusive. After all, I was doing well. I was serving as an elected official in Boston. I was still practicing medicine. I had just become a new dad. So why would I want to build this new government agency and turn around what had been a complete failure in the early days of COVID-19? Because that was the task. For those of you who are unaware, prior to my appointment, there are 2 veteran homes in Massachusetts that provide long-term care. One is based in Chelsea, which is not far from here, and the other one's in Holyoke, Massachusetts, in Western Mass. And sadly, over 100 veterans lost their lives at both homes in one of the largest nursing home COVID tragedies around the country. Worse, when the investigations were complete, it proved to be a glaring example of what goes wrong when government lacks leadership and accountability. So why did I decide to take this on? Why risk so much? Well, because like many of you, whether it was an experience you had or a person you met, something inspired you to believe in something bigger than yourself. And for me, I happened to be on deployment when I began discussing the job with Governor Healy. And I found myself unable to extract this future possibility with my work in real time, where I was providing medical care to soldiers. I couldn't escape the fact that our community needed help. And if I could play my little role in serving, maybe, just maybe, I could have a positive impact in the lives of some veterans. So long story short, I took the job. For the past 2 years, we've undertaken a mission to honorably serve those who served us. And we've done so by providing a vision, offering resources, and acting with urgency. And while we have a lot more to do, I'm proud of the progress we've made. We've been able to transform both of these veteran homes in Chelsea and Holyoke. Think about this. Several years ago, these organizations were operated in dilapidated buildings, were unlicensed facilities with unlicensed staff. There was a lot to be desired. In fact, they were still using paper medical charts. Not only have we built a brand new building, state-of-the-art one in Chelsea, but we secured $500 million to build a new one in Holyoke that's under construction and ahead of schedule. Both veteran homes are now licensed by the Department of Public Health, operated by administrators licensed to do their job, which was never the case before. They now have electronic medical records, and I can promise you that the quality care is being offered is to the standard, and that our vision to make these homes the best long-term care facilities for veterans in the nation is fast becoming a reality. And in the midst of all this transformation, we did even more. We passed the HERO Act, the state's most comprehensive piece of veterans legislation in history. We invested $20 million to address veterans' homelessness and have so far provided permanent housing to over 100 veterans while adding hundreds of units in the construction pipeline. We were able to do this because we believe that leadership begins with listening. And that authentic engagement leads to trust. In fact, I can remember my very first visit as secretary. I don't know if you'll remember this, General. I was at Home Base, nonprofit in Boston, doing amazing work with our veteran community. And we talked about the need to rebuild trust through engagement. And that's precisely what we did. We actually built an entire office dedicated to outreach and engagement. And not just because it feels good or folks want to be heard, which are all true, but because it actually matters. Almost every study on veteran services that I've read, no matter the subject, no matter if it's a city, state, or federal benefit or program, the gap is always engagement. Truth be told, that services are often good, programs can be life-changing, but if nobody knows they exist, well, then nobody knows, and it becomes a lost opportunity. And that's why I'm honored to join you here today on an issue that I feel so passionate about. Because although my work as an ER physician often interfaces with issues like mental health and substance use, this current job has added an extra dimension. Let me just say that I've seen my fair share of sadness and tragedy. For 10 years, I've worked in one of the toughest emergency departments in America, seeing the very worst of our society, all of its injustices, violence, and death. And in the military, I've taken care of devastating battlefield injuries. And despite these experiences, even learning how to manage my own emotions, when I became secretary, I wasn't prepared for the number of calls I'd get from families, spouses, parents, who were calling me to express their own sadness at the loss of their cherished service member or veteran, often due to suicide. And it really hit me. I think I naturally assumed that spending more time in an office and a bureaucracy would somehow separate me from the front lines. But I came to realize that I don't ever really want to leave the front lines, because that's where I learn, that's where I get my inspiration from, and that's where I can just be human. So as the calls kept coming, we knew we had to do more. One of the first things we did was put together a group to study the issue of veteran suicide, which confirmed what we already know, that veterans are more likely to commit suicide, that things like substance use, PTSD, and other mental health issues are often associated with it, and that firearms play a disproportionate role. We ended up investing $2 million in multiple organizations working in this space. We also received a grant from the federal government to develop a suicide mortality review board focused on veterans. And while these are steps forward, there's still so much more to do. But I'm a forever optimist. And you all being here today gives me even more hope. I mean, just look around this room. This is what commitment looks like. Veterans, researchers, clinicians, first responders, leaders across every sector. Different backgrounds, different expertise, but we all have one shared purpose: to improve the lives of those who serve. Because as we all know, service doesn't end when the uniform comes off. We know the challenges: PTSD, TBI, substance use, suicide, and we know the numbers. But behind every number is a name, a veteran, a family, a story. And for me, it's those stories that, although tragic, they can inspire. They also challenge me and give me urgency. And I know many of you feel the same way. So as we continue to take on these complex issues, we know they demand new solutions, new partnership, and new ways of thinking. That's what this summit is about: breaking down silos, rethinking approaches, and building a system that actually works for those who have given so much. Because for too long, veteran mental health care has been treated as a one-size-fits-all system, and that simply doesn't work. We need more access to innovative treatments, from new clinical therapies to research on psychedelics. We need to actually invest in a workforce and not cut it. We need a greater focus on prevention, not just reacting to crises, but identifying risks early. And over the past 2 years, this is what we've tried to accomplish at the Massachusetts Executive Office of Veteran Services. I'm proud of the work we've been able to accomplish in a short time, but the truth is, we can't do this alone, nor do we want to, because this work requires each and every single one of us. So to the researchers, here today, your findings are so critical. And we know more than ever how much we need you to reach those front lines. To the clinicians, your work changes lives. Believe me, I know how challenging the healthcare system can be right now, but we need you more than ever. To the veterans and service members, you are not just the recipients of care, you are the experts in what works. Your voices must shape the future. And to the policymakers, our commitment must match action with our words. So folks, the work ahead won't be easy, but I firmly believe in this room right now, we have the people, the ideas, and the momentum to transform veteran care for the future. So I'll leave you with this. A few months ago, I met a veteran who told me something I won't forget. He said, I don't think I needed help until I did. And that's the reality for so many. That's why we got to be proactive. That's why we have to lead with listening and build trust through engagement. And that's why I'm honored to be here today to reimagine healthcare, break down barriers, find new ways forward. Because if we get this right, we don't just improve services, we save lives. We give veterans and their families the dignity, care, and support they've earned. And that's the mission worth fighting for. So thank you again for the opportunity to join you this morning, share a couple of words. I'm grateful for all that you do, and I look forward to today's conversations. Thank you.